I might get started. Just to start with, I want to acknowledge the traditional custodians of the lands that we're all meeting on in various different places around the world. I'm on Whadjuk Noongar Boodja over in Western Australia, and I want to pay my deepest respects to elders past, present and emerging, as well as any First Nations people in the Zoom room today. And obviously very important given the topic that we're talking about today with data sovereignty. So this is the second last webinar of the year in this series that we're calling the Australasian Justice Health Network webinar series. And we've had some fantastic speakers already. We're already setting up our schedule for 2024, but we're absolutely thrilled to have presenting for us today Dr. Ruth Cunningham and Dr. Paula King from New Zealand. They'll tell you more about themselves in due course, talking about contextualizing Indigenous data sovereignty in justice data. I don't want to take too much of their time, but they've both got pretty impressive CVs, so very brief bios. Dr. Paula Toko King is a public health physician and senior Kaupapa Māori researcher with expertise in quantitative and qualitative research methods, including ethical co-designing with tamariki and rangatahi Māori children and young people. And I'm sorry, Paula, if I'm massacring any of those words. I'm doing my best.
That bad, Stuart.
Yeah, thank you. Okay, here we go. Paula is based in Te Rōpū Rangahau, Hauora, Pōmare at the University of Otago in Wellington. How did I go, Paula?
Oh, you did better before, but keep going.
Yeah, I'm going downhill. Associate Professor Ruth Cunningham is a public health physician and epidemiologist working in the areas of health equity, linked data research and mental health. Ruth is based in the Department of Public Health at the University of Otago in Wellington, New Zealand. And it's a real thrill to have these terrific speakers with us today. So I will now hand over to Ruth and Paula, who are going to give a presentation, and we'll hopefully have some time at the end for discussions. So thanks very much. Over to you.
Kia ora, Stuart. Mea mahi nui kia koutou katoa ko Waitene, ko Paula Toko King taku ingoa, ko Ngāpui, ko Ngāti Whātua, ko Te Aupōki, ko Te Rarawa, ko Ngāti Maniapoto, ko Waikato Tainui mea iwi, e mahi ana hau ki te Rōpū Rangahau Hauora i Pōmare. Kia ora. Thanks very much for the introduction, Stuart. I just want to make sure that Ruth gets a chance to introduce herself, and then we'll talk about what we're going to sort of work through with you today. Do you want to talk, Ruth? Or you?
Sure. So kia ora koutou, ko Ruth Cunningham tōku ingoa, ko tangata tiriti au. As Stuart said, I'm a public health physician, and most of my work has focused on marginalised populations. And I guess I just wanted to have a shout out here to, no, that's not me, to Rohan Borshman and to the work that he's been doing. And he had a poster next to mine at I think it was might have been an AEA conference, I can't remember, and recognising that the work that he was doing with looking at mortality after release from incarceration inspired me to think there's data that we have on this in New Zealand and we're not using it. And so that drew me into the area of working in incarceration and drew me together with Paula, which has been fantastic. But yes, I'll leave it there at the moment and hand over to you, Paula, to introduce the kaupapa of this talk.
I guess we wanted to talk through some of the work that we're doing in this space, and Ruth and I have kind of come from, I guess, different frames. So my background has been more in kaupapa Māori research, but more around tangata whenua rights to wellbeing, so Māori sovereignty rights to wellbeing under our te tiriti and under sort of other human rights instruments like the United Nations Declaration on the Rights of Indigenous Peoples, etc. And so both of us have kind of been working in the area of inequities in different spaces and maybe using different approaches as well. So we've kind of like come together in the last couple of years, haven't we, Ruth, around this space. I would say that the work that I do kind of covers quite a few areas, because I guess if you're talking about a tangata whenua rights approach to Hauora, most of the rights are for, tamariki rangatahi, which is Māori children and young people, and Pākeke, kaumātua, so our adults and our elders are breached in a number of areas. So that's why we've kind of ended up in this space as one of the areas, but there's like many others in terms of obviously we're very similar for Indigenous peoples in Australia around care and protection, disability, imprisonment, etc. So that's how we've ended up being in here in this space. I just want to, before we go forward, is definitely I want to acknowledge some of the people who've been leading the way in Māori data sovereignty and Indigenous data sovereignty as well, which is Associate Professor Donna Cormack, who's based at Te Kupenga Hauora Māori at the University of Auckland, also Professor Tahu Kukutai, who's based at Waikato University. A lot of their work has kind of influenced my thinking around the space. I also want to acknowledge Associate Professor Bridget Robson on this, who's also on the in the audience today. Sorry, Bridget, I just thought I'd mention that because Bridget's been leading the work in this area around Kaupapa Māori epidemiology and appropriate methods with regards to dealing with Māori data. I also want to quickly acknowledge Te Mana Rōranga, which is the Māori Data Sovereignty Network, who's been working in this space for probably, a number of years to really push the agenda, and also Te Kahui Rōranga, which is the iwi data group network as well. So just to highlight, because a lot of the things that we're talking about today have been influenced by them. So we just want to move to the next slide, Ruth. Sorry, it sounds like I'm directing you, but just jump in whenever as well. So I guess I just want to, just in terms of context, I don't think this is any different for the experiences of Indigenous peoples in Australia. So Professor Tracy McIntosh has worked in this space for a long time. She talks about the warehousing of surplus humanity in prisons, the ongoing incarceration of Māori in particular, is a crisis that's resulted in an unjust society where the shadow of the prison colonizes our landscapes for far too many people, especially our children. It colonizes their future. And we just go to the next slide, Ruth. So I suppose we're just sort of highlighting what do we currently know within our own context in New Zealand. And we definitely know that, similar to the situation for Indigenous peoples globally, Māori in the nation state currently known as New Zealand have been imprisoned on a mass scale. Currently, Māori are about 52% of the prison population, which is about 4,624, compared with 16.5% of the general population. The rates of imprisonment for Māori women are the proportion of Māori women in the prisons are even higher than the proportion of Māori men, but the numbers are higher for men, which will be very similar. It's a similar situation for Māori children and young people who are in the youth justice residences and in the prison youth units as well. And also acknowledging, just as this whole network acknowledges, that imprisonment is increasingly recognised as a determinant of health across the life course for individuals, whānau communities, and the documented body of research around the relationship between racialised imprisonment and broader health inequities. So do you want to talk to the work that we've kind of done so far, Ruth, with the link?
Yeah. So I mentioned that starting to talk to Rohan and learning about the Merrick study was an opportunity to come into working in this space, and so Paula and Bridget and I and others recognised that we had the data in something called the Statistics New Zealand Integrated Data Infrastructure. So we had linked data on lots of service contacts with the state, linked up to health data, and therefore the opportunity to look on a whole nation level at what was happening to people who had come out of incarceration. And so we did this initial work to look at mortality among people who had come out of incarceration. And we looked at people coming out of both prison and remand in this work. And we found, what others have found was an extremely high rate of mortality among those who are coming out of incarceration. So this demonstrated to us that it was an important area in which we should be using and demonstrating this in order to think about how to address these inequities. We found it was useful, I think, to look specifically at the remand population, and we found particularly high rates of death by suicide among those who are coming out of remand. But we found, high rates of death for both natural or chronic disease causes, as well as other causes. We found some things which tell us that the New Zealand context is different from other countries. So we don't have those high rates of substance use, overdose in the period coming out of prison, because that is not, we don't have high rates of injecting drug use in New Zealand. But importantly, we found, which we already knew, that a very high proportion of those who are incarcerated in New Zealand are Māori, and it led us to think about what the important questions were and how we could dedicate. So this was that classic, let's get a little bit of money to start doing something, and then actually this is a really big piece of work and we need to do it justice and do it properly. And so so this led into our work that's specifically been focused on Māori after incarceration, which Paula is now going to talk about, and then I'll come back to some of this IDI stuff.
Thanks, Ruth. Yeah, so I guess one of the things that we want to acknowledge is that the work that we're doing is on community re-entry, and the reason for that is that there is actually, there's been decades of work in the space around the injustices around imprisonment for Māori in this country, and especially led by Māori Māori legal scholars, activists, practitioners, etc. So we were wanting to make sure that the work that we do adds as a kind of collective approach, and the area that is really under research or under looked at, under examined, is the community re-entry space for Māori and also for Indigenous populations on a global level as well, in terms of what's in the evidence base. So we wanted to kind of focus on an area where we could, contribute to the impacts from a collective perspective. So I'm just going to talk a little bit on the next slide just about the current, really more describing the current projects that we're doing. So there's two that we're kind of talking to today, and then we'll kind of talk around the tensions around how we approach Indigenous data within these projects. So the first one is Tiaki, Community Wellbeing for whānau with Lived Experience of Imprisonment, which is funded by the Health Research Council, and Ruth and I lead this with our colleague Cheryl Davies, who works for Tukotahi Kokiri, which is a community-based Māori service provider and Māori research organisation. And if you go to the next slide, Ruth, I can just kind of talk to what we're doing in this for Tiaki, which is definitely focusing on community re-entry wellbeing, using routinely collected government data, which is Ruth has kind of highlighted that in terms of the Stats New Zealand IDI for adult Māori and the factors influencing their wellbeing outcomes. And also we've really focused on ensuring that we resource Māori who have lived experience of imprisonment to be their own researchers and to develop strategies for self-determined pathways, supporting positive community reentry wellbeing. It's a Kaupapa Māori project. The majority of our research team are Māori, and also our research project advisors and are Māori, and also include Māori with lived experience of imprisonment. I think when I talk about resourcing Māori, we're basically ensuring that it's, that they're financially resourced to the same level as if they were a university researcher. So that's, we've been really intentional about that, and also having all the training and professional development around that, because we kind of feel that this type of project is, it's not just about, yes, quantitative and qualitative data and, what are the findings from that. It's also about the way we do the research, which is why we've been quite specific about how we support people involved, and really, I guess we call it whakamana, when we kind of elevate or really value the lived experience of whānau who have been in these situations. So this is really focusing on adult Māori experiences. And if we go to the next one, so we've just been funded, it's only just started this year in July, is Ngā Hau o Tāwhiri, which is called Returning Our Mokopuna to the Winds of Tāwhiri. And this project is kind of focusing on the younger age group, so between 10 to 24 years, to Māori children and young people with lived experience of being in youth justice residences and in prison. And we're working, can you go back, Ruth?
Oh, sorry.
Yeah. I just wanted to highlight that we're working with Toi Maturua, which is a rangatahi research, so Māori young people, their own research institute that's based in the community, and they gifted the name to this project. So the project name is based on a Māori proverb, or whakatauki proverb, which is talking about returning to your maunga, your ancestral mountain, to be cleansed by the winds of Tāwhiri Mātia, which is one of our atua. And it's kind of the metaphor for sort of fresh new approaches that are led by young people with lived experience, allowing us to better understand and address the health and wellbeing impacts of imprisonment for themselves and for their families and communities. So if we just go to the next one, it's sort of a bit similar in terms of what our objectives are, in terms of looking at the using the data in the IDI. The only thing that we're doing is a little bit different. It's kind of looking at using ethical co-designing of community reentry strategies led by Toi Maturua and mokopuna with lived experience. So we're using the word mokopuna. It's kind of a term that we use in, when we talk about Māori children and young people. And so I think it's a little bit different, because some of the Toi Maturua tend to do a lot of, like, they've got a decade-long history of working with Māori children and young people in the community, and they do a lot of participatory work. So a lot of their work is like films or theatre marae. That's the kind of pedagogy they use. So some of the outputs they want to do from this is about doing audio books, theatre, a lot of stuff like that. So it's a little bit different. I'm not saying that the Tiaki one, we've got people involved in terms of supporting our researchers with lived experience, and they're the ones who develop the theatre marae pedagogy in terms of like using that specific Māori theatre, Māori performative art. So they actually are the people that have led it, and their names are on the slides: Jim Moriarty and Dr. Helen Pierce-Ortinier. So we may end up doing that, but for the Tiaki one, it depends on what people want to do, what our researchers want to do. But yes, the Tāwhiri one is very participatory, arts focused. Yeah. So if we go to the next slide,
Yeah.
So you want to talk to this one?
Yeah, I'll talk to this one. So thank you, Paula. So clearly we're at early stages in this work, and we'll be excited to come back and present to you all of the things that come out of this work. But coming into this work, I think that it's really important for us to, I guess what we want to talk about today is how we're thinking about doing this work, and in particular how we're thinking about the use of coerced data within the integrated data infrastructure, within the quantitative part that I've been leading. We have data which is data which has come out of situations of violence, essentially, and it's data which is then held by the state and is part of this this large collection of data, but which has all sorts of data in it. It has data from surveys, it has data from services, sorry, excuse me, I've dropped my crochet hook, services which people have more willingly engaged with, and it has this data related to the justice system as well. And within the integrated data infrastructure, there has been some thinking in New Zealand about the ethics of using this data, and about what frameworks and guidelines we need to guide us for the whole integrated data infrastructure, including making sure that we are working with communities whose data it is. So when we are doing a project that, as you can see we are doing, when we're doing a project that relates to the justice system, it's really important that we have people with lived experience involved in our project, and that our work is really informed by that experience. So there are some guidelines and thinking around the ethical use of data in the IDI, but neither here in New Zealand nor elsewhere are we aware of any particular thinking about whether we need to think differently about data harms, or the potential to do harm or to impair or injure with the data that we have, where the data is taken in circumstances of coercion. So we were really interested in sort of developing these ideas within an Indigenous data sovereignty context, to think about how can we safely use this data. We think it's important to use this data to hold the state to account, but we also recognize that this data is not something
people didn't consent to this data.
People didn't consent to this data being collected or used. And I guess holding it in real contrast to the data that we do collect qualitatively in this work, where we do have explicit consent for the use of that data.
I was just thinking, Ruth, just reflecting on what you're saying. It's also about this. There's just no, in terms of its circumstances of coercion as well, when we know that that's really will be the case. I mean, it's got applications outside of, we're talking about obviously the justice sector, but this occurs elsewhere. I mean, I think one of the, data that's collected on people under the Mental Health Act is not off, can be coerced data. We talk about seclusion and mental health services, which we already do. There's quite a bit of work that's been done around inequities and seclusion, etc. I mean, I actually did the work as well. But I guess on reflection, I do think that there's a lot of like the application in terms of what we're sort of thinking through has kind of considerable application to other areas, definitely in health, but also in social services and things like that. So
yeah, and I guess just following on from that, the data that gets collected by government is very often data about bad things happening, and so how we and that data can really be used to it often tells terrible stories, and how we find ways of creating useful, hopeful narratives and positive change out of what's often very negative data, I guess is sort of a broader a broader implication of this work.
Hmm.
Shall I hand over to you to talk more about Indigenous data sovereignty, Paula?
Yeah, sure. So those are the things we've been thinking about, and we would have liked, I mean, we would have liked it if we had found where someone had, you know, already looked at the coercion issue, but we couldn't find anything. It would have been great to have looked, but we couldn't. There isn't anything. So yeah, but in terms of like thinking from the perspective of Indigenous data sovereignty, which is sort of the kind of umbrella for how we'll have to approach the data anyway. And I guess just quickly talking through it about what it is for people who might not be aware. I mean, it's been around for quite a long time now, at least like since probably mid 2000s in terms of Indigenous data sovereignty. Which is considered the right of a nation to govern the collection, ownership, and application of its own data. It derives from tribes' inherent rights to govern their people's lands and resources. Māori data sovereignty comes back. Oh, do you want to just go back to that definition, Ruth? Māori data sovereignty has come out of this Indigenous data sovereignty kind of collective advocacy movement, and Māori data sovereignty has kind of come about. I mean, I would say it's definitely still considered emerging in terms of the application of Māori data sovereignty, but it's been around since at least like 2015 is when it really started to like take off in terms of like being grounded in the evidence base and everything like that. And I guess the background for Indigenous data sovereignty is thinking about data relations and practices for Indigenous peoples. You know, Indigenous peoples have long histories of being classified, measured, and monitored as part of colonial practices, the imposition of new knowledge systems and practices on Indigenous peoples, and representations drawing on the 5 Ds, which is what Professor Maggie Walter, who's based in Australia, one of your Indigenous leaders in Australia, talks about disparity, deprivation, disadvantage, dysfunction, and difference. I think Ruth was kind of already sort of alluding to that in the previous slide about the nature of those sorts of things that can come out, or things that outputs that can come out of when you use the IDI. And for Māori, in the context for us, in terms of states and corporations have gathered large amounts of data about Māori, and it can be used by Māori to monitor the impacts of state action and inaction. So that's kind of the approach that we're coming from, but we have to be mindful of the context that data sets still remain, the data sets themselves are essentially kind of concerned with serving state and corporate interests, and also they're frequently inconsistent, quite irrelevant. The quality can be quite awful, quite terrible quality, and within untrustworthy environments and externally controlled. And we've already sort of highlighted, we know that Māori are, there's a mass imprisonment of Māori here, but we've already sort of realised, I think it's not a surprise, but we've sort of come across the undercounting of Māori in prisons in terms of their poor quality ethnicity data. So even though Māori are like highly overrepresented on paper, it's actually a massive undercount too, well, at least by 12%, something that we've found already, and we're just doing some further work to explore that. So do you want to, sorry, Ruth, if you just go to the next slide. Yeah, I don't think I need to talk to this too much. It's sort of highlighting, where the whole point about data sovereignty, Indigenous data sovereignty, is shifting the locus of power over Indigenous data from nation states back to Indigenous peoples. And when we talk about data, we're talking about, for Māori, data about Māori people's environments. It's more than human relations is kind of what we're meaning when we're talking about the term data in this context. And yeah, I mean, it's reaffirmed in like international conventions, declarations, and policies, including under the UN Declaration of the Rights of Indigenous Peoples, the fundamental rights to free, prior, and informed consent, which we don't have. I think if we go with regards to the context that we're working in, the justice and health data, yeah. And I just want to quickly go through more as an example on the Māori data sovereignty principles by Te Mana Rarunga, which I talked about before, the Māori data sovereignty network. And so they talk about principles such as rangatiratanga, authority, whakapapa relationships, whanaunatanga, obligations, kotahitanga, collective benefit, manaakitanga, reciprocity, kaitiakitanga, guardianship. And if we go into the next slide, Ruth, it's I'm just talking about one of the principles more as an example about how it can be applied in the context of data. So in terms of control, Māori have the inherent right to exercise control over Māori data and data ecosystems. This includes, but isn't limited to, creation, collection, access, analysis, interpretation, management, security, dissemination, use and reuse of Māori data in jurisdictions. Decisions about the physical and virtual storage of Māori data showed enhanced control for current and future generations. Whenever possible, Māori data shall be stored in Aotearoa, New Zealand. And Māori have the right, and self-determination, Māori have the right to data that is relevant and empowers sustainable self-determination and effective self-governance. So that's one of the examples. If anyone's interested, I can send the links to the resources and things. Is very useful. Do you want to go to the next one? So this is just an example of some of the work that's been done around data governance. So Māori data governance is more about the mechanisms that ensure that data sovereignty rights are fulfilled. So I'd call, so that's how, data governance comes in under that. And Te Kahui Rarunga have just released a really good resource about how to, around the application of Māori data sovereignty to data. So they talk about the values. Nurturing data as a tonga is something very special. Use data for good. Put iwi Māori data in iwi Māori hands. Decolonize data ecosystems. Be accountable. And the next slide's just got some underlying foundational po about the things that need to be focused on in order to meet the obligations to the data sovereignty. So data capacities and workforce development, data infrastructure, data collection, data protection, data access, sharing and repatriation, data use and reuse, data quality and system integrity, and data classification. So I guess the next thing we want to talk to is about what are we actually doing in this space for these specific projects, and how we're working through these things, because we've kind of, obviously we're using a Māori data sovereignty approach that is informed by principles of Māori data sovereignty. But I suppose our question to our reflections are, but is that enough in terms of the use of coerced data? So some of the things that we're working through right now is we're doing, we haven't quite completed it yet, but we've done a data scoping review of the application of Māori data principles, because there's been a huge amount of work around the conceptualization of Māori data principles, but because it's sort of still kind of an emerging area for Māori data sovereignty, there's not as much work done around the area of the application of principles. I would say that that's really is very emerging, and there's some work happening in pockets now, but even with our scoping review, not a huge amount has come up, which makes sense. The previous slides where I talked to Te Kahui Rarunga, their Māori data governance model, that's very new, but that's a very good example of something that's now out in the knowledge base around the application of Māori data sovereignty principles. So we're wanting to come up with some really good examples of application to be able to inform our tikanga framework around our approach to the how we're going to do the analysis and framing around the Māori data that we are looking at for this project. one of the things when I talk to a tikanga framework, so that's I'm referring to tikanga Māori. So tikanga Māori are kind of Māori values and principles and ways of being. It's derived from Māori law. So pre-colonization, tikanga was our ways of engaging with one another, and very much is kind of very similar to Dr. Moana Jackson, who was a Māori legal scholar, kind of world-renowned Indigenous leader in these spaces. He's obviously done a lot of work in the area of prison and the justice area as well, but he always talked about his background was law. He'd always talk about tikanga Māori being our laws. So we're kind of going from that, kind of using that approach as well to say that we need our tikanga framework for how we approach this data, and there's lots of things that will feed into it. So we've worked together with our research team and including our researchers with lived experience to come up with our tikanga values about how we will work together in this project, but how we will also how the values will inform how we look at data and how we present it, and how we kind of look after it as well. So that's what we're doing. The outcome of the Māori data sovereignty scoping review in terms of like examples about kind of application of principles will be really useful in informing that work. So we're doing all of that at the moment with regards to how we'll do the analysis, but we don't feel comfortable going forward with presenting anything to do with the Māori data realistically until we've kind of really been intentional about what we're doing at every stage. Is there anything else that you wanted to add to that, Ruth? I was just trying to think through.
No, I guess I was just thinking that, so I mean, for both of us, we've worked with Māori data a lot in the past and as Paula said, she's got a background in Kaupapa Māori epidemiology, that some of the considerations in that work are things like who's the appropriate comparison population, and increasingly how do we centre privilege in the how do we examine privilege when we're looking at Māori data and sometimes looking at Māori and non-Māori in comparison? How do we think about how do we think about what good looks like so for example, in some of my work looking at first episode psychosis, the comparisons that we made for Māori with first episode psychosis, often we were interested in making a comparison to non-Māori and who didn't have an experience of psychosis. So rather than so looking at who the most privileged group is and using that as a comparison, just as a slightly more concrete way of talking about where some of this thinking might take us in terms of how we actually present and talk about the work that comes out of this project.
I think it was a good example, because from the perspective, and I guess Bridget would talk to this more than me because she helped develop it, but there was the thinking around what a comparator group would be. So, when one of the leading kind of resources that came out of the was Hauora 4, which was led by Bridget and Associate Professor Ricky Harris as well in the Eru Pōmare Centre. That's when the thinking came out around kind of talking about like what comparator groups might be in terms of like Māori. If you've Māori as tangata whenua have the rights to wellbeing, and the privileged group is the non-Māori from a treaty perspective. So we have used non-Māori in the past, but then I guess when you think about who's the most privileged group, actually non-Māori might on its own might not be the most privileged group when you think about who's categorized under non-Māori, which is also, for example, Pacific peoples or refugee groups, and also, you know, so quite often a different group might be, say, the New Zealand European group might be considered the most privileged group. Well, it is the most privileged group, but used as a comparator. So there's all those sorts of things. In our case, we're thinking about, okay, well, what's the, you know, what, when we frame who a comparator group might be, that can actually cause harm too, in terms of saying what the narratives could come out from that in terms of deficit kind of narratives around Māori. So there's all these sorts of things to think through, which is why we want to ground our stuff, I suppose, in this sort of robust framework. Yeah, and so I think we've come to the end of what we're talking about, but we did have some questions for the broader Rōpū group, which would be really helpful to talk through. So we're thinking about, you know, for everyone, what's the thinking around how might our data practices and relations be embodying colonial, capitalist and racial logics? For example, surveillance would be one of the major things that comes, you know, to bear in mind for these spaces. And also what we are really interested in hearing from others about what their approaches are in terms of addressing harms from data practices and relations within the justice health context and all the work that you do.
Sorry, I've got a visitor. There's a bird in the house, so she's escaped from us.
So I think if we have a cordial discussion, that'd be really useful. And Bridget, if there's anything else that you want to add as well, based on what we've talked about, or any reflections that come to mind, that'd be really useful, but no pressure.
Thanks very much, Paula and Ruth. That was a really provocative discussion, and I really appreciated your both the conceptual thoughts and some of the practical considerations. And I think it is a really important discussion to be having. We do have about 15 minutes for comments and questions. I can see there's one comment from Jackie Short in the chat already, and perhaps others might want to unmute and ask a question. Louise, I think you're first.
Excellent. That was so interesting. Thank you so much. My question is, have you done much thinking about, in terms of managing the logistics, I suppose, around, say, linked administrative data, and, you know, how in practical ways, how you might be able to manage the kind of principles of Indigenous data sovereignty in an effective way, given that it's I guess it hasn't been collected with those principles in mind, and it seems to raise a lot of challenges. I'd love to know how you're sitting with that one. Thanks.
I think that's a really good question. Thank you. I think the Te Mana Raronga, the Māori Data Sovereignty Network, and also the Te Kahui Raronga, who are the iwi data groups network, they have literally come about because of the question that you've asked, in terms of so what they've done is that work's still happening, because it is a massive tension, you know, and so the data governance model is a way of moving forward about how you would manage that, the issues that you've raised and things. But it is a huge challenge, because you've got all this data sitting there that has been collected, and so this is ongoing work.
I guess the other thing that I would say is that by using and exploring the data, we have the opportunity to influence some of the ways that it's collected. For example, how is ethnicity data collected in the corrections system? Not well. But by starting to look at that and explore the data quality issues, and explore the reasons why it's important with the agencies that are collecting that data, I think we do also have the opportunity to to influence the data that's being collected by using it and by looking across different data sets. So I think, yeah, I think that there are, doesn't have to be one way, I guess.
Yeah, and also I guess when we talk about data relations, we're kind of thinking about how are we behaving in relation to the data. So we have to, I guess the tikanga framework is about our relation to the data, right, and how we're managing that. But then there's also ways of having an impact on the way others relate to the data, which is kind of what Ruth was talking about, especially, and there's some things we can do, like ethnicity data. That's a shocker in terms of like how it's being collected. And, the policies that they're doing are based on the numbers with regards to, like, there's been a whole lot of policies that have come out of corrections, which kind of focus on like lowering, they've talked about lowering the number of Māori in prison, things like that, which, there has been a downward trend. That might change because we've had other changes in our broader political kind of arena, but even so, we are the numbers decreasing? That's kind of a question we do actually ask. We have to ask based on the fact that there's been considerable undercounting of Māori by the Department of Corrections. But that's a really great question. Thanks, Louise.
Anyone else? I had a practical question, Paula and Ruth, which is that as a non-Indigenous person working in this space and constantly trying to learn and get better at navigating this, I feel like I've struggled to get clear guidance on how to approach these issues, and perhaps it's just not simple. And, one of the thought-provoking things that you've highlighted for me today is it's not just about what we do with the data, but coming to appreciate the ways in which the data, the existence of the data in the form that they are, is inherently problematic. And just coming from that place as a starting point is useful. But do you think there is scope for developing some sort of concrete guidance for people working with big data in this space, or is it perhaps a bit too nuanced and complex and sort of context specific for that?
I think thanks, Stuart, that's a really good question. I think from the perspective of Indigenous data sovereignty, it's been a significant amount of work that's been done at a global level, and there are the different frameworks that are already available from the States and Canada and New Zealand and Australia. So there is work that's been done for that. And I would definitely say that I can only talk from a Māori data sovereignty perspective in terms of the application of Māori data sovereignty principles. I think that's still a bit emerging, but I would imagine that it's a little bit more advanced elsewhere. I think I did see a systematic review, probably not that, I think it's only a year old, and it was in Australia about Indigenous data application of data principles. So I can flip that to you anyway, Stuart. But I think with regards to the actual context that we're in terms of justice and health, I do think that there is work that needs to be done, and we are trying to, with the two projects that we are kind of working through, because we have to do it, like we've got to do it. I do think that this is probably the start of kind of the thinking around the being in relation to the like justice data and corrections data, etc. But I still think it's got massive application in every other space that Ruth and I have worked in. When I did the seclusion for Māori in mental health services, like it was probably about 10 years ago, I was really going from the lens of tangata whenua rights. So, that with the right, but it actually, on reflection, I think back, okay, but that data was always Kuus data that I was using, and there was no thinking around that. So I do think that has further application outside of just this space.
Thanks, Paul. I see we've got a question from Lindy and then one in the chat from Amanda from Canada.
Oh, thanks, Stuart. And thank you both, Paula and Ruth. That was a really fantastic presentation. My brain's popping off here. Stuart, you sort of jumped the gun and asked the question that I wanted to ask about being a non-Indigenous person grappling with some of this. And so that was great hearing that answer. I guess the other thing that I wanted to think about in relation to this is, again, in terms of positioning myself in this, it's about, you know, the links to truth telling, if you like, and the links to, you know, is reflection on that truth telling in the data. So if you're using data and you're linking that to truth telling and you're reflecting on that and what that means and reflecting on your own position in that, I mean, I don't think that's enough, but I feel like it's a starting point. And then for me, I'm a manager of research and evaluation within a community services sector. So what does that mean and it's an Aboriginal community controlled organisation. So what does that mean from the position of the organisation and our obligations to the community? So for me, it's about bringing the community into all of that. But yeah, what I was going to ask was, you've mentioned so many frameworks and things, and I just couldn't catch the wording and everything, but I was wondering if you might be happy to share that either in the chat or share it with Stuart, and Stuart can forward on or something like that. Yeah, I think that's all. I've lost train of thought now, but thank you. It was so thought-provoking, and you know, Wanjaning's embarking on this journey now, so it's sort of like raised a lot of things for me. Thank you very much. Thank you. And thanks, Stuart, for organising.
I might just quickly read out the question from Amanda, and then we'll go to Lindsay. Amanda says, in Canada, we have something called the OCAP framework, which has gotten some traction, but the problem is that our federal privacy legislation is fundamentally incompatible with Indigenous data sovereignty, and nobody wants to do the hard work of legislative reform. That wouldn't be a unique experience. Do you have any legislative barriers to the application of these principles in New Zealand?
Thanks for that question. And yes, I was referring to the OCAP framework as well when I was talking about the different frameworks. So thanks for raising that, Amanda. I would say no. This is a conversations we've had with our Indigenous colleagues overseas as well. Like there are kind of legislative things that get in the way of operationalizing data sovereignty. I wouldn't necessarily say that we have that here. I wouldn't say that we do. What I would say is there's a lack of will. So I do think that what we're seeing, and yeah, if you've got any reflections on that too, Bridget, just definitely jump in. But what we normally see is a lot of tokenism, and we normally see a statement of Māori data sovereignty is really important. But that's kind of the extent of it. So yeah, I think that's really where we're at. But I wouldn't say there were necessarily at all legislative barriers to it. I think there'd be a lot of things around logistical barriers, for example, in terms of where data is stored and things. So when you're thinking about data stored in the cloud, you're like thinking about where is Māori data actually stored and what jurisdiction is the data under, because it's definitely not under here when it's stored. So there's all of those kind of logistical things, but I wouldn't say there's a legislative barrier, just more lack of any will whatsoever to kind of do the right thing. Yeah.
Thanks, Paula. And Lindsay, probably the last question.
A lot of pressure. Thanks, Paula and Ruth. Really interesting. And I think my question we've already touched on very briefly, but I guess I'm thinking more upstream from the control and the ownership aspect of data. Obviously, a lot of the data that is available for use and collected is collected by the systems that are responsible and instrumental to oppression of First Nations peoples in many countries. And I'm originally from Vancouver, British Columbia, and in British Columbia, there's a First Nations Health Authority. And the way that the data linkage works there is that you need to apply to the First Nations Health Authority in order to access identifiers of which individuals are Indigenous in the population. So in doing so, you need to work with them, put together a proposal, and have some collaboration on what you're planning to do, the questions and how you're going to answer them, and community engagement whatsoever. Amanda probably has a lot more experience working with them. I'm just wondering if you've seen any of these types of models elsewhere, if you think something like that could work in New Zealand, Australia, and if there's any potential problems with that. Obviously, it doesn't solve everything, but it could be a starting point.
No, we've kind of talked to some of our colleagues that are Donna Cormack and I were in another talking about Indigenous data sovereignty. She's like the major expert on it. But that was the same with our colleagues who are in the States. They were talking about a similar kind of model that you're talking to, Lindsay, and we were just saying, yes, that's what we want. So I think it's more like that iwi, like te kahui raronga, these are the things that everyone's kind of advocating for. So that's what the networks are wanting, because ideally that is actually what we would have. So that's, yeah, we don't have that here, but we would want, iwi want to hold their own data and kind of, not just iwi, but at the hapu level, like at the, I guess you call it sub-tribe, iwi's a tribe, sub-tribe level, holding your own data. That's really what they want, and having control over it at that level. And that was some of the things that some of the tribes that some of the people who are talking about what their tribe does is, that sounded like a really good model. It's not what we have here at all. Yeah, but that's what people are working towards. I mean, definitely some of the Māori organisations are holding their data, like they have that model with their own data, and that's been definitely influenced by the Māori data sovereignty movement. But and iwi are definitely progressing that. But I guess I would say that it's not happening absolutely everywhere. It's still, I guess I would call it maybe emerging. Yeah.
Thanks, Paula. So, I mean, clearly this is a discussion that needs to continue. And I suspect that we'll be revisiting this next year. It is a really important issue that's relevant to, I think, everyone's work that they're doing here. We are just about at time. Just before we wrap up, I just want to give a quick plug for our next and final webinar for 2023, which is Dr. Caitlin Patton, who's an ED physician and public health trainee currently based at the University of Melbourne. That's going to be on Friday, the 1st of December. We'll send around the details soon. Please come along. Caitlin has a fairly unique and diverse perspective to share on some justice health issues, so it promises to be a great presentation. But this was an outstanding presentation and discussion, and I want to thank you both very much again for very thought-provoking conversation, and certainly it's a step on the journey for me in learning more about how to work through these issues in the justice health context. So thank you very much. Be well, and we look forward to seeing as many of you as possible in 4 weeks' time.
Thanks, everyone.
Thank you.
Bye, everyone.
Bye.